Hello friends, let's see the short and important topic of the upper limb, that is the axilla. The content of the axilla we are going to learn in the upcoming sessions. But now let's move on to the concept of the axilla. What do you mean by axilla? The axilla is the area which is actually in the layman's language called as the armpit. So armpit is situated between the upper part of the arm and the lateral thoracic wall. So this area it is called as the axilla. We can feel the concavity within the armpit, and this is the base of the axilla. So axilla is a pyramidal shaped space which is situated between the upper part of the arm and the lateral thoracic wall. As this axilla is pyramidal shape, we can find there are apex of the axilla. In this figure, we can appreciate this area is the apex of the axilla, and this apex of the axilla it is truncated. It has one base. So here this area is the base. We can feel the base of the axilla as a concavity in our armpit. It has one anterior wall. So this wall, what we can see, this is the anterior wall of the axilla, and it has one posterior wall also. So here this wall is the posterior wall. It has one medial wall which is situated as the lateral thoracic wall, and it is going to form the medial wall of the axilla. So here we can see this one is the medial wall, and the lateral wall it is very narrow, and it is going to be formed by the fusion of the anterior wall and the posterior wall, and it is going to be formed by the humerus bone having one bicipital groove within it, and that bicipital groove it is mainly formed this lateral wall of the axilla. So this axilla is the gateway for the structures which are going to enter into the upper limb, either from the head and neck, either from the thorax. So this axilla is very important area for the upper limb. And the many important structures which are going to supply the upper limb, they pass through this axilla. Or we can say it is the only gateway to the upper limb from the head and neck and the thorax. Now let's move on to the structures which are going to form this individual wall of the axilla, and then we will see the content of the axilla in a nutshell, and the detailed anatomy of the structures which are present within the axilla, which we are going to deal in the upcoming series. So when we see the apex of the axilla, this apex of the axilla is situated on the superior side, and it is going to be formed by this border. This is the superior border of the scapula, which is situated laterally. Medially, the apex is bounded by this outer border of the first rib, and anteriorly is going to be formed by this posterior border of the clavicle. So the apex of the axilla is going to be formed by the scapula, first rib, and the clavicle. This apex of the axilla it is also called as the cervico-axillary canal. So this can be asked as a short question or as the MCQ. The cervico-axillary canal is nothing but it is the apex of the axilla. So this apex of the axilla it is also called as a cervico-axillary canal. The whatever the structures they are going to enter into the axilla, they has to enter via this narrow irregular apex, and through this narrow irregular apex mainly the subclavian artery is going to continue as the axillary artery, and the subclavian vein is going to continue as the subclavian vein through the apex. So these are the two important structures along with the brachial plexus, the cords of the brachial plexus, which are going to be formed by the C5 to T1 roots. They are going to pass through this apex of the axilla to enter into the upper limb and going to supply the upper limb. Along with this axillary artery, axillary vein, and the cords of the brachial plexus, few other structures are also going to enter through this apex of the axilla, or we can say via this cervico-axillary canal. And one of them is the long thoracic nerve. This long thoracic nerve as we are going to discuss in our upcoming lecture, this is going to supply the serratus anterior muscle, which is the direct branch from the root of the brachial plexus. So it also enters into the apex of, so it is also going to enter into the axilla via this apex. So these are the structures which we are going to deal them separately in the upcoming series. Now let's move on to the other boundaries of the axilla. So for that, we have to take one transverse section of the axillary region, and we can find this figure. So this one is the transverse section of the thoracoaxillary region. So for the orientation, this side is the anterior side. We can see this structure is the sternum, and here this one is the rib. And on the posterior side, we can see this is the scapula. So this is the transverse section of the body of the scapula. And on the lateral side, we can see this is the humerus bone. So when we see the other boundaries of the axilla, it is going to be formed by this anterior wall, posterior wall, medial wall, and the lateral wall along with the base. So first move on to the base. The base of the axilla, it is going to be formed by the skin and the superficial fascia as well as the axillary fascia. This axillary fascia, it is the continuation of the pectoral fascia, which is going to be get remain in the concave shape by the action of the suspensory ligament of the axilla. For the suspensory ligament of the axilla as well as the axillary fascia, kindly see my separate video of the pectoralis minor muscle. So that pectoralis minor along with the clavipectoral fascia we have learned in my separate lecture, and you can go through it. So the base is going to be formed by the skin and the superficial fascia along with the axillary fascia, and the concavity of the axillary fascia, it is maintained by the suspensory ligament of the axilla, which is the continuation of the clavipectoral fascia below the pectoralis minor muscle. Now let's move on to the anterior wall of the axilla. The anterior wall of the axilla, it is going to be formed by the pectoralis major muscle. So here in this figure, we can appreciate this muscle is the pectoralis major muscle. So the anterior wall of the axilla is mainly going to be formed by the anterior axillary fold. We can hold the anterior wall of the axilla with our hand, and that is the pectoralis major muscle. The spiraled fiber of the pectoralis major is going to form the anterior wall. Along with the pectoralis major muscle, we can see the one more muscle which is situated under it, and that muscle, it is called as the pectoralis minor muscle. So these two muscles along with the the subclavius muscle, it is in the line of the pectoralis minor muscle, and that also going to form the anterior wall of the axilla. Now let's move on to the posterior wall of the axilla. So for the posterior wall, we find this muscle, and this muscle, it is going to attach with the body of the scapula on its ventral aspect, and this muscle is the subscapularis muscle. Along with the subscapularis muscle, two more muscles, they are also going to form the posterior wall. The main muscle is this one, and this is the latissimus dorsi muscle. The spiral fiber of the latissimus dorsi muscle is going to form the posterior axillary fold, which we can hold with our hand at the site of the armpit on the posterior side. And just behind the latissimus dorsi muscle, we find one more muscle, and that is the teres major muscle, which is going to insert over the medial lip of the bicipital groove of the humerus, and that muscle, it is also going to form the posterior wall of the axilla. So posterior wall of the axilla, it is going to be formed by three muscles. One is the latissimus dorsi, one is teres major, and subscapularis muscle. The main spiraled fiber of the latissimus dorsi is going to form the posterior axillary fold. Now let's move on to the medial wall of the axilla. The medial wall of the axilla is going to be formed by this muscle, and this is the serration of the serratus anterior muscle, and the serratus anterior muscle having 8 serrations, which are going to get insert over the scapula on its medial border on the ventral aspect. So the serratus anterior muscle is going to form the medial wall of the axilla. Along with this serratus anterior muscle, we find the intercostal muscles, the upper portions of the intercostal muscles, they are also going to form the medial wall of the axilla. So the lateral thoracic wall is going to form the medial wall of the axilla. Along with the serratus anterior muscle, the long thoracic nerve is going to supply the serratus anterior, and it is also present within the medial wall of the axilla. One more nerve which is present within the medial wall of the axilla, and that is the intercostobrachial nerve. This intercostobrachial nerve is nothing but it is the undivided lateral cutaneous branch of the second intercostal nerve. So this intercostobrachial nerve can be asked as a short question. So this intercostobrachial nerve, you have to remember, it is nothing but it is the undivided lateral cutaneous branch of the second intercostal nerve. And this intercostobrachial nerve is going to pierce the medial wall of the axilla and going to supply the posterior-medial part of the upper part of the arm. So the skin of the posterior-medial part of the upper part of the arm is going to be supplied by this intercostobrachial nerve. This can be asked as a short question or as an MCQ. Now let's move on to the lateral wall of the axilla. The lateral wall of the axilla is going to be formed by this intertubercular sulcus, or we can say bicipital groove of the humerus. One tendon is situated within this intertubercular sulcus is the long head of the biceps tendon. So long head of the biceps tendon, it is going to be formed this lateral wall of the axilla. Along with the long head of the biceps brachii, we find two more muscles. One is the short head of the biceps brachii, and one is the coracobrachialis muscle, which are also going to form this lateral wall of the axilla. So this is all about the walls of the axilla. Now let's move on to the content of the axilla. The main content of this axilla is this main artery, and that artery is the axillary artery. The detailed anatomy of the axillary artery, which we are going to deal in this upcoming session. Along with the axillary artery, we can appreciate that the chord of the brachial plexus are situated around it, and these chords of the brachial plexus, according to their site near the second part of the axillary artery, this one is the medial chord, this one is the lateral chord, and here this one is the posterior chord of the brachial plexus. So the three chords, they are present around the axillary artery, they are also going to form the content. Just near to the axillary artery on the medial side, one vein is present, and that vein, it is the axillary vein. Along with that, we find this long thoracic nerve which is going to supply the serratus anterior muscle. It is also the content of this axilla. Intercostobrachial nerve, as we have discussed previously, that it is also one of the content of the axilla, which is going to uh, pierce the medial wall of the axilla and enter into the axilla to supply the posterior-medial part of the skin of the upper arm. Along with that, the axillary fat is also present within the axilla, and the axillary lymph node, which we are going to see in the upcoming session, they are also present within the axilla. Along with all these contents, sometimes the axillary tail of the breast, it is also present as the content of the axilla. So this is all about the boundaries and the content of the axilla in a nutshell. Hope you understand well. Thanks for watching.